Okay, hello to everybody. I'm just waiting a second to make sure everybody can join, but wanted to give a very warm welcome to everyone for joining this webinar on adaptive social protection, decentralization, localization, challenges and opportunities for good governance in social protection delivery. So this is part of a series, an Aspects webinar series, which aims to inform the global public policy dialogue on building systems back better following the social and economic crises caused by the COVID-19 crisis. And the series is organized by GIZ, Global Program Social Protection, Innovation and Learning, on behalf of the German Federal Ministry for Economic Cooperation and Development, in cooperation with socialprotection.org and other partners. And each webinar brings together practitioners, leading experts, and policymakers to share and exchange perspectives on adaptive social protection, to focus on specifically practically relevant aspects of 3 different ASP building blocks. So today we're focusing on the first one of good cooperation and coordination. And then other webinars will explore the other 2 building blocks, which are social protection programs, data, and then data and information systems and financial resources. So in terms of the objectives today, we know that social protection requires cross-sector cooperation and collaboration from multiple actors. And so in the case of adaptive social protection in particular, these integration, synergies, and synchronization is especially necessary. So institutions, we know, are obviously hugely important to ensure a comprehensive and coordinated approach so that coverage can scale up horizontally or vertically as needed in terms of the scale of the population who's reached, the adequacy of transfers, the range of services provided, and within government provided and sort of regular social protection, decentralization efforts as part of good governance initiatives are really important for the delivery of social protection, in general. And at the same time, increasing capacities of local humanitarian responders has been one of the major commitments made by signatories under the Grand Bargain process. So we know that subnational and local government actors are obviously crucial in any social protection system, but they're especially important to consider in the context of adaptive social protection and how they can scale up and adapt delivery according to people's needs and the changing context and any shock conditions. But there's no simple decentralization equals good formula that we can apply. This is really highly nuanced. It's specific to each national context. There's no best practice that you can apply everywhere. There's really just, it's about a best fit. But what does that mean exactly? The best fit for what and for whom? And what does this mean for efficiency, inclusion, accountability? And how do we understand what this would look like in different settings? So lots and lots of questions. It's such an interesting area. And today the top objective is to provide some conceptual clarity on these interconnections between decentralization, localization, and adaptive social protection. So we'll begin with Dr. Andrew Wyatt, who will provide this conceptual framework for understanding the linkages between decentralization, localization, and social protection, how they relate to each other, and what the implications are for the design of these adaptive systems. And Andrew is an independent consultant now, but has previously served for over 23 years in the UK public service as a policy advisor, manager, trainer, and training manager, also as the director of the government group at the Civil Service College, as well as many years as a consultant. And then from this conceptual framework, we'll then get to hear from 2 really interesting and relevant case studies. So the first is by Tiago Cacau on the case of Brazil, including the development of the Bolsa Familia, the single registry, and the Auxilio Emergencial program responding to the COVID crisis. And Tiago is a consultant at the World Bank focusing on social protection and jobs issues in Brazil and other countries in the region. And he was formerly the head of the National Secretariat of Income Citizenship in charge of the Bolsa Familia program. And finally, a presentation will be by Vilma Cabrera on the challenges and opportunities of decentralization, localization, and adaptive social protection in the Philippines. And Vilma has a wealth of experience in adaptive social protection and humanitarian responses, including serving as the Undersecretary for Disaster Risk Reduction in the Philippines. And her latest assignment, she was designated Senior Child Protection Officer at UNICEF. And then after the presentations, we'll save around 40 minutes for questions and discussion. So we really want all of your questions and thoughts. So we'll invite you to use the chat box, which is on the bottom there, just for conversations amongst yourselves. But any questions that you would like to ask of the panelists, please use the Q&A box instead. I'll be monitoring that to gather questions together to ask to the panelists. And just a reminder that the session will be recorded, and both the presentation and the slides will be shared by email. So those will be coming your way. And with that, sorry, I just realized I didn't introduce myself. I'm Emily Wild, and I'm a consultant working on social protection for many years, and I'm part of the SPACE program that's been looking at COVID responses. So great, I guess we'll go ahead and I'll
Okay. Right. Good afternoon, good evening, good morning, everyone. I hope that you can hear me okay. My feed from Emily just froze there. So if the moderator would like to give me permission to share my screen, I will do so. Okay. Right. Okay. I hope, as I that everybody can hear me. Okay. I think the key word in the title of this presentation is the exploring. There is something slightly sort of tentative and exploratory about what we're trying to do in mapping some of the connections between social protection generally, adaptive social protection, decentralization, and localization. The background to this study is that I was commissioned with my former colleague Valentina through the Space Initiative for GIZ to develop a desk study, which amongst other things was intended to provide a conceptual framing of the discussions on the interconnections between social protection, ASP, decentralization, and localization, and to identify critical entry points for identifying complementary programming across the decentralization and ASP interventions, and for linking those agendas in dialogue with government partners. And this paper was intended initially as a starting point for discussion within GIZ, as very much a practitioner focus, but I think we'll be able to share it more widely as soon as we have reached a final version. The starting point for what we've written is an understanding that this simple question, that is decentralization good or bad? Does it help or hinder adaptive social protection? Can't be answered simply. And I think Emily has already alluded to this in her introduction. This is largely because both decentralization and social protection are very broad terms which embrace a huge number of different types of program and service and different forms of governance. So the need to specify, to address some further questions. First, what kind of social protection are we talking about? What form of decentralization? In what wider context of social economy, institutional framework are we talking about? So we began by unpacking these key terms using familiar analytical categories. We didn't think that we needed to reinvent the wheel. Lots has been written on both of these topics. So just to give you a quick flavor of what we were, the forms we've adopted. We adapted and adopted the well-known distinction between different forms of decentralization, between sort of deconcentration, more or less a geographical dispersal of functions within government organizations, delegation either within government or to local government bodies or outside of government, and devolution, a more radical transfer of functions to subnational bodies which have their own political mandate and legitimacy. And I think what we can also say here is that that mandate and legitimacy also applies, as I think we'll hear when we talk about Brazil shortly, to the autonomous units within a federalized structure. And the distinction is more than theoretical. It's important because it's really only when we get to this sort of devolution or federalized structures that issues of real transfer of political decision-making and some of the benefits in that sense of decentralization begin to appear. Decentralization, I think, is usually often regarded as an unalloyed good thing. It's been seen for development partners for quite a long time as part of a broader good governance and democratization agenda. It's seen, rightly, I think, very often as increasing and diversified participation. It can, although it may not always, act to improve the equitable distribution of resources between areas and also between groups in society. And it should, in theory, make services more reflective of and quicker to respond to local needs, and that includes local needs as they emerge in crisis situation. However, the extent to which these benefits are achieved, it depends a lot on what kind of decentralization is pursued, in what kind of social, economic, and political context, and also precisely what responsibilities are transferred and how, and others with what restrictions, under what conditions. Localization is the other term in this pack, and we'd understand in this case localization as broadly a drive to apply a sort of subsidiarity principle, that things should be done as locally as possible, both to humanitarian action, and Emily referred to the Grand Bargain, which commits donors and humanitarian actors to support local bodies, local actors first, as the first responders usually to crises, but also more generally in a more general sort of sustainable development context. Local subnational governments are seen by many as key to sustainable development and achieving the SDGs because of their greater proximity to local communities compared with national level bureaucracies. However, what I would say here is we haven't said a great deal more about localization, because that general orientation, direction of travel doesn't tell us much about how local is possible, how local is best for different types of adaptive social protection or routine social protection intervention, and also through what institutional structures that can best be achieved. And then, social protection, to unpack the final big term here. Again, different authorities will have different definitions, write in different ways about these things. We've worked on the basis of a fairly familiar, I hope, 4 pillars model, which distinguishes between social insurance, largely contributory schemes, social assistance, usually non-contributory programs for the poor or vulnerable cash or in-kind transfers, social services, a range of residential, domiciliary, psychosocial support and other services for vulnerable groups, and fourthly, active labour market policies, the range of activities intended to increase the access of the unemployed to the labour market. So as there are various some people would classify these in different ways, but we think the 4-pillar model is quite robust. And what follows, I think, is that different types of social protection will benefit from decentralization to differing degrees. For example, a national social insurance fund may be best administered centrally, particularly with increased digitalization, remote provision of services. The most efficient way, both fiscally and administratively, may be central provision, but social services in particular may be best suited to decentralized provision, closest to the community to which they're meant to serve. And where you have a service with a large decentralized or dispersed workforce which needs management and supervision, that becomes even more the case. But also, the different components of a social protection system, both at the policy and program design level and then at different stages of the delivery chain, may be located at different levels of government. So, for example, under the social assistance heading, a cash transfer program may be based on a single registry information system, which might be a central function of government, while outreach and registration may be delegated to local offices or to local government. Policy may be a national function or may be devolved to subnational levels. So there again, there are a lot of variables here. And that's simply a sort of space-oriented visual representation of these different levels with the delivery chain around the outside of the circle. Adaptive social protection we have seen as essentially concerned with the ways in which those systems can be enhanced to support households to prepare for, cope with and adapt to mainly covariate shocks, like large-scale shocks, hurricanes, pandemics, earthquakes, affecting large areas of the community. ASP, I think, aims to build resilience to shocks and to respond to shocks, the ability of households to respond to shocks when they occur, but needs to leverage an existing range of programs and services under all of those 4 pillars. As we see it as a focus, an approach, a way of working within those 4 pillars rather than a completely different category. And shock response may require some more localized approach to some functions than would be the case under routine programs, but also critically, I think, requires strong coordination with a wider range of local and national actors, and that may be a challenge in heavily decentralized systems. And I have to say that coordination across the pillars and between different levels of government is often a weak aspect of social protection systems, even in non-critical, non-emergency situations. They are typically dispersed across a number of institutional actors, ministries and departments within government, and communication and integration is not always strong. So this is the an attempt finally at a visual representation of how these variables fit together, the overall context, the social protection specific considerations of which sort of social protection program are we talking about, what sort of function or activity within that, and what the levels of capacity are to deliver that at local level. And then when we come to talk about the adaptive social protection with coordination in crisis situations being a critical issue, who needs to be coordinating on what the capacity is to do that, and is everybody working on from the same sheet? Is every agency involved decentralized to the same degree? And then finally, under what mode of decentralization are we talking about? A devolved system with different levels of political mandate and commitment, or a more administrative decentralization? So just two things further to say. As an aid to profiling the arrangements that exist, both current and proposed, we have argued that the starting point when change is proposed, when either originating from proposed reforms of the social protection system, or for changes in the degree or nature of decentralization within governance generally, there's a need for practitioners from both of those often quite different streams, work streams, to be able to enter into dialogue, to understand where they're starting from and what the implications of proposals are. So we've developed a sort of matrix for profiling both the existing situation, both under institutional form, the type, the activity within the delivery chain, the extent to which there is an ASP focus, and the nature of coordination that takes place, and how to be able to, as a basis for developing a sort of matrix to describe current systems, and then identifying the implications of potential change. And then finally, a set of key questions to begin to interrogate proposals for change and development around headings of ownership, value for money, responsiveness, equity, resource allocation, coordination, and always this sort of sub-questions here about, is the proposed change more or less decentralization, differences in the way that social protection is delivered or ASP is organized? Is it going to make things better or worse, basically? How is it going to help? And what are the implications for other programs? And so I think I'm out of time at that point, so I will simply say thank you very much. That, by the way, is a photograph of a social protection program, a maternal nutrition, cash transfer and health joint program in the Gambia, just in case you're wondering. And thank you very much for your attention. I hope I haven't gone through that too quickly to make sense. Thank you.
Thanks very much, Andrew. That was a great introduction, and I'll just do a little tiny housekeeping in the meantime. I know I cut out, Zoom died on me at the end of my introduction, so I just wanted to add in a reminder that this is being translated into Spanish, live translation, so anyone can click on the interpretation button at the bottom to get to that channel to listen in Spanish. And please do feel free, everybody, put your questions in the Q&A when you have them. And for Spanish speakers, feel free to ask your questions in Spanish. Those will get translated for us into English so we can ask them to the panelists. Okay, with that said, I'll switch over and we'll switch over to Tiago's presentation now.
Thank you, Emily. Thank you, Andrew. It was a very nice presentation. I think you made our work a little bit, our task a little bit easier with all the conceptual framing. I will try to share the screen with you. Hope it works. Is it okay? Okay, so first of all, I would like to thank you for the invitation, the opportunity to, it's a great pleasure to be here with you. A special compliment to the organizers of this meeting for raising the discussion of a so relevant topic for the current moment. We know that adaptive social protection and the links between ASP with decentralization, localization were already important aspects of the international debate before the pandemic, but now this becomes a central agenda in the post-COVID context. So during the next 10 minutes, I have the challenge to present to you the federative structure of Brazil, some aspects of the organization of social policies in the country, And I will give you some practical examples of Bolsa Familia, our well-known CCT program, and also the example of the recent experience of the emergency support in response to COVID crisis, auxílio emergencial. At the end, I will bring some challenges and lessons learned from these experiences, and think about the aspects of this decentralization and localization in this way. So let's start with some general information from the Federative Republic of Brazil. We have a population of 212 million inhabitants, and a total area of 8.5 million square kilometers. Economically, Brazil is classified as an upper middle income country, rated as one of the most unequal countries in the world, with poverty rates still significant and with an upward trend in the recent years. But what I want to highlight here is the composition of the Brazilian Federation, with 26 states, the federal district, and 5,570 municipalities. This federative structure combines both subnational autonomy and a national level of coordination. States and municipality, they are autonomous federative entities, and they have a constitutional guarantee that allow local governments to establish their own social agenda, for example. The union is the main financer of the process and responsible for regulation and coordination of the intergovernmental relations. To make the system minimally functional, it was necessary to establish a series of coordination mechanisms, especially in the social policy. So in the health sector, we have a single system by a decision from the municipalities and the states, with competences defined for each governmental instance, and with participatory entities, the National Health Council and states and municipal secretariat forums to discuss what the challenges and the lessons they need to share. In the education sector, they work with a minimal expenditure per instance, and also the division of competences. Just for an example, the primary education is main responsibility from the municipalities. States are more responsible for the secondary education, and the federal government with a relevant role in the higher education system. Again, with participatory entities, the National Education Council and states and municipality secretariat forums. For the social assistance sector, it is organized also as a single system, with services are very, in the main cases, are municipal competences. The states and federal government, they have the responsibility to finance and qualify the system. And the union maintain the national monetary benefits, especially Bolsa Familia and BPC, which is a specific program for disability and elderly out of the traditional pension schemes. So the social assistance team is also with participatory entities, National Council and forum from states and municipal secretariats. The creation of Bolsa Familia required, in 2002, required a new level of coordination in this system. So the municipalities assumed the role of the registers and conducting the interviews and feeding the registering system. The municipalities also, they have the task to monitor the education and health conditionalities and provide additional services for the beneficiaries of the CCT program. The states, they provide technical support, staff training, and contribute to management improvement to the municipalities. And the federal government regulates the program, maintain the registration and benefit payment management systems, and select the beneficiaries and finance all the process. In big numbers, Bolsa Família, it's right now with 14.7 million beneficiaries families. Around 25% of the Brazilian population is enrolled in the program, with an average benefit per family of $40, an annual budget running around $6 billion. And it's a very well targeted program, with 70% of the transfers reaching the bottom 20 of the income distribution. Cadastro Único, our single registry, is the backbone that made the expansion of Bolsa Família program possible. It's based on a federative coordinated approach, which has an active massive registry. The use of the registry is mandatory for all the social assistance federal programs, but it's also totally available for subnational governments who wants to use it in support to their own initiatives. Contains national rules and norms and concepts. It provides a capacity building for the municipalities with instruments, tools, and researches. Has inbuilt a series of incentives and specific payments for this process, and involves a very large communication strategy. In big numbers, we have 77 million citizens in Cadastro Único, in the single registry. Almost 40% of the Brazilian population is already registered and with update information. And in these groups, we have around 3 million traditional and most vulnerable families, like indigenous, culturally specific groups, more vulnerables, homeless, child labor, and so on. With services stations all over the country, in all the 5,570 municipalities, with more than 9,500 municipal registry offices. Auxílio Emergencial is the emergency aid created in response to COVID crisis in 2020. It covers informal and unemployed workers, including those who were already in the single registry, and Bolsa Família beneficiaries when advantages for those families. It is supported by the traditional system from Bolsa Família and Cadastro Único, an intensive use of technology to enroll all the groups, and also for the eligibility process, and with digital accounts for payment. We can say that this experience was a rapid, generous, comprehensive, and extensive response to COVID. But it's important to highlight that it was very centralized by the federal government. States, yes, could launch the complementary initiatives, but the program was very, very centralized. We are talking about a program with almost 69 million beneficiaries, 65% of the Brazilian population enrolled in this process, if we take the beneficiaries and all the households, with an average benefits of $120, 60 billion annual budget, 15 months of extension right now, with 100 million digital accounts created for the program and for the other social programs that were already in place in the country. Well, with this in mind, with this experience in mind, I want to talk about challenges, finish my presentation with challenges and lessons learned. The first main challenge I want to highlight here is the heterogeneous local capacity. In Brazil, we have such different, if we're looking for at municipalities as the unit level of decentralization, we need, in the Brazilian case, this is a totally heterogeneous world. We have municipalities as São Paulo with 12 million inhabitants, and we have Borá in the same state of São Paulo, nearby São Paulo, with less than 1,000 inhabitants. So there are huge difference between this unit level that we call municipality. We also have to highlight this idea of unit local contest. This is a very good argument for decentralization and localization, but how to maintain a minimal quality level for the programs and guarantee that even the most the less developed units are also covered by the social assistance scheme. Vulnerable groups, there is a difference between the distribution of vulnerable groups between the municipalities as well. So this idea that what I want to say is that adaptive social protection and these ideas of decentralization and localization cannot be a tool to reinforce inequalities. It's a risk existing in the process. So how to guarantee a minimal homogeneous services quality, how to handle with the fiscal restrictions of specific units of decentralization. And this becomes even higher when we are talking about unpredictable events and emergency that needs fast response. To reduce or overcome these challenges, we have some lessons learned that I want to share with you to end my presentation. The first lessons learned, it's the necessity of the adequate and predictable financial support. Also with counter-cyclical mechanisms. When we are talking about social protection, it's important to highlight that. The idea of freedom to spend the budget in the local context, it's also something that we learn very well. There's no one-fits-all solutions that can be defined by the federal the government. We know that result-based management tools, they can work if they were well designed, given the right incentives for the decentralized units. Social control is essential. If you're working locally, it's necessary to control locally. And the constant monitoring process at the central level to enhance quality, service, and homogeneity of some of the services some services and benefits that are supported. Additionally, I would highlight the necessity of the simplicity of rules and the good communication, especially with the staff and beneficiaries. And very important is the special attention for the services team, the street level bureaucracy, and be careful with the relations created between beneficiaries and the street level bureaucracy. It needs to be covered in the idea of rights and not in the idea of favors or in other kinds of relations in the territory. By the end, I want to talk, just highlight the idea that technological, yes, it's very technology. It's a very important instrument to solve problems, but it did not solve all the problems. and it's an important ally, but be aware of the algorithmical dictatorships that we have in some kind of social protection programs. I finish here, and I'm really interested to hear about your comments and questions in the next session. Thank you.
Thanks so much, Tiago. That was really interesting. And I think we've already got some questions coming in on that. So we'll have a chance to explore a bit more as we go. But in the meantime, we'll get to hear from Vilma and hear a very different context in the Philippines. So Vilma, please go ahead.
Thank you. Good morning, good afternoon, good evening to all. It's an honor to be part of this very important webinar, and I appreciate the invitation sent to us by the organizers. I'm presenting the Philippine experiences in terms of the localization and the partnership between the local government units and the national government units in the Philippines. Okay, just briefly and to give context, I'm presenting, sharing with you the country's profile in terms of poverty, disaster risks, and different disasters occurring in the country, as well as the social protection implemented in the country now, and the challenges that we encountered in terms of partnership with the local government units and the opportunities that we have spotted in terms of enhancing partnership cooperation with the local government. Okay, so for context, the Philippines poverty rate is quite high. It's still a two-digit number. So 19.8 in 2020, and expected to be, as projected by the World Bank, the poverty rate in the Philippines will be reduced to 18.7% by end of 2021. However, because of the occurrence of COVID-19 pandemic, challenges confronted the country in terms of economics and the social aspects of the country's economy. And then if you'll note, the portion or the areas in the map that are colored red are the areas that are usually affected by adverse disasters. And these are also the areas where most of the poor population or poor households are residing. Okay, so the Philippines, as an archipelagic country located in the Southeast Asian region, is visited by no less than 20 typhoons every year, and at least 5 of these tropical cyclones are very destructive. So you'll note that the country had been placed as third most at-risk country in the world in 2018 and had improved a bit, 9th in year 2020. So you'll note that just for tropical cyclones, for a period of 5 years, the country had a population of 6.2 individuals adversely affected by disaster. So you may also note here that there are other types of disasters occurring in the country. For COVID-19, this is quite a serious concern of the country's leadership. We had been placed twice under the enhanced community quarantine, the highest quarantine category in the country, and in coming August 6 to 20, there will be another enhanced community quarantine declaration, and the entire metropolitan Manila areas will be placed under ECQ. So in May 2021, the individuals affected is 1.1 million, but you'll note that as of July 24, 1.5 million individuals are or had been affected by COVID-19 already. So there had been an adverse impact on employment. In May, 4.2 million workers were reported to have been unemployed because of the temporary or permanent closures of businesses affected by COVID-19. Just last week, the current unemployment rate, which include unemployed or underemployed, had reached 12 million individuals because they cannot go back to other employers currently because of closure. And also those who had worked abroad cannot go back to the countries where they used to work. Okay, so for social protection that the country had implemented so far, even before the outbreak of COVID-19, the Philippines had implemented Pantawid Pamilyang Pilipino program, or 4Ps, which is a conditional cash transfer program. This is basically influenced by Tiago's Bolsa Familia in Brazil. And this is a nationally led conditional cash transfer covering 4.4 million poor households across the country. Now, Pantawid Pamilya had provided a platform to mount a scaled-up and speedy response to poor and vulnerable households affected by shocks and disasters, particularly during the occurrence of Super Typhoon Haiyan. Government and humanitarian partners piggybacked on the 4P systems and infrastructure to deliver unconditional cash, therefore complementing the benefits that had been provided by Pantawid Pamilya. Monthly, beneficiaries through their parent leaders conduct family development sessions, which include family and community disaster preparedness in order to increase resiliency among the residents of barangays or villages usually affected by disasters. Pantawid Pamilya had proven to be very effective in leveraging with other programs such as emergency cash transfer and social amelioration program. The second type of social protection, which is very adaptive and had complemented with Pantawid Pamilya and other modalities, is the emergency cash transfer that had been started during the time when the Super Typhoon occurred in 2013. The World Food Program of the United Nations, together with UNICEF, had leveraged and had piggybacked on Pantawid Pamilya to support the adversely affected households and individuals in 9 regions in 100 plus municipalities all over the Central Visayas region, Western Visayas, and Eastern Visayas. Okay, so Typhoon Haiyan experience in 2013 had driven the ECT to be implemented, and it is now adopted by the National Disaster Risk Reduction and Management Council of the country as one of the national interventions for disaster response, rehabilitation, recovery of affected families and individuals. Implementation of ECT was triggered in areas declared under state of calamity and with operational market. It prioritizes on Pantawid Pamilya beneficiaries and poor families under the DSWD's National Household Targeting System for Poverty Reduction, or in its DSPR. This is a national database of poor households. The rate of emergency cash transfer provided is 75% of the regional daily minimum wage for a particular number of days, and the maximum would be 90 days for disaster response, and cash aid equivalent to the national rate provided for emergency shelter assistance. The third one, this is the biggest, the largest nationally led unconditional cash transfer provided by the government to cushion the impact of COVID-19. So it had been distributed by the national government, which funded the operations, but with active involvement of the local government units. The first distribution reached 18 million families, including 40 beneficiaries in the different areas affected by or with high incidence of COVID-19. The second distribution on areas declared under enhanced community quarantine. And the third one was conducted only in the National Capital Region and the 4 provinces surrounding it. The fourth one is a locally led post-disaster interventions, which consist of food and non-food or limited cash to provide support to victims of disasters as well as COVID-19. Okay, so these are the numbers of our local government units. Barangay is the primary unit of the country, of governance in the country, municipality, city, and provinces. So you'll note that there are more than 40,000 barangays, and this serves as the support of the municipal government in terms of providing strategies in targeting beneficiaries for social amelioration program and other assistance such as food distribution. So the local government unit at the municipal level is actually the ones releasing the amount in coordination with the support of the national government through its local social welfare and development officer. So you'll note here the different responsibilities of the levels of government in the country. For the challenges that the government had encountered, particularly in implementing the social amelioration program, number one is that of the issue on collecting data. This had been conducted manually, which provided the beneficiaries the opportunity to fill up on their own the forms. However, it delayed because the paper-based data collection system is not reliable and easily is prone to manipulation by unscrupulous sectors. The second one, the second tranche leverage on digital payment delivery in collaboration with 6 financial service providers. But there's also an issue encountered because of the weak internet connectivity and phone signal, therefore encountering difficulties in informing the beneficiaries or the officially listed beneficiaries at different LGUs. Then the third one, the tranche that had been implemented by the LGU in terms of prioritization and distribution of assistance. The LGUs, most of the LGUs had conducted a face-to-face distribution of the financial benefits, exposing the beneficiaries to danger of contamination or infection of COVID-19. Now, for the different categories of disasters, data collection again came out as an issue, particularly on its low reliability and the slow progress in administering a disaster assistance family access card. For conflict situation, it's the same. The low quality and the danger of being manipulated because the forms are paper-based. And for COVID-19 pandemic, the LGUs use their community-based management system, which is a local planning and programming tool, instead of using the National Household Targeting System database, resulting to issues on conflict of names of beneficiaries and different sets of beneficiaries targeted for the social amelioration. Overall, the challenges in terms of our partnership with the local government units, while there's a clear concept of coordination and had been greatly and commonly spoken about, there has been a operationalization of coordination between the national and local governments in implementing the adaptive social protection. As we have experienced in the implementation of social amelioration program, the coordination in terms of data collection and prioritizing beneficiaries had evolved as an issue on this aspect. Then the data on poor household was also an issue because there's no common database with unique ID or identification for prioritizing beneficiaries for all social protection interventions, including that of emergency cash transfer and social amelioration. The National Household Targeting Database, which is the national targeting and this the national database of poor households. Currently, it contained 15.4 million poor households and 5.2 million of which are poor. This had not been updated for the past 5 years. So this is the reason why local government units insisted on using their own community-based management system, thinking that the current NHTS has not been precise enough in terms of data target and prioritizing the poor beneficiaries. Then locally implemented program may be quicker and responsive. And this is very true. It might be quicker and responsive, but there's an inequality between and among LGUs because of their different fiduciary capacities. So the income classes of the LGUs differ. So not all local government units may be able to provide the same rate, the same standard provided for by the national government when they implement the localized social protection program. Then localized implementation lead to different rates or typology of benefits, payment modality, duration of assistance, and modality of support. So others may provide cash only. Others may provide a combination of cash and non-cash items such as food and non-food family packages.
Hi, Vilma, if you can just wrap up in the next few minutes, that'd be great. So we have time for the questions.
Okay. So for ways forward, digitalization and interoperationalization of the data at the national and local is being identified as one priority. Then, as mentioned earlier, the face-to-face distribution increase the risk of contaminating or being infected with the virus. So the participation of the authorized government depository banks and financial service providers is very much a priority also. And then the conduct to increase the resiliency of the families and the communities through the family and community disaster preparedness. Okay, now for the core messages, My first message is that of the importance of a national database of the poor that is interoperable with local databases. Then the roles and responsibilities of the local government units need to be included in the design phase of any social protection program for operational clarity and guidance. And then the importance of piggybacking for efficiency in the operations, particularly on the existing structures and systems, and the use of digital payment schemes to prevent the spread of the virus. Thank you very much. I end my presentation with that. Thank you. Maraming salamat po. Mabuhay.
Thanks so much, Vilma. That's really interesting. Both you and Tiago have given us really, it's a challenge. These are both such interesting systems with so much detail. So you've managed to give us a really good picture of this. And so we've got about 25 minutes or so for some questions, and we've been getting some great ones already in the Q&A. We've got they're kind of ranging in a few different topics, really. So we've got some questions on systems and how those work, kind of the nitty-gritty of it in the intergovernmental context. We've got some questions around inclusion and also about some different kind of contexts as well. So I wonder if I might start with some of the issues around inclusion, because these are you know, this is really one of those areas where it's often assumed that the more decentralized, the better it will be for inclusion. So, but you know, what's the evidence that we have on this? How well this actually happens? You know, is there good evidence that the more local it is, it excludes any social, or it doesn't encourage any social inclusion, that the most vulnerable are included? Or are there issues of elite capture, particularly in both these cases of the Philippines and Brazil, where there's this single registry, where also there's some kind of different complexities involved, where there's more quantitative approaches to targeting and what that means. And I'd like, this will be for each of the panelists, maybe start with Andrew and then go on. But so, you know, what is your take on some of these ways that at the local level, you know, whether the most vulnerable find it difficult to register, and what does that mean? And then what does it also mean for gender and the implications for gender and for the way that women are able to be included or not? So maybe Andrew, do you want to, do you have any thoughts on that one to kick off, and then I'll move to Tiago and Vilma. Oh, you're on mute.
Okay, not muted now, I think. Okay, thanks for that. Thanks for those questions. Those are two quite difficult issues to start with. I mean, there is the point that Richard Isham has made there. I mean, the question about what happens to people who don't manage to register. And there's a real sort of, I think, important trade-off here, that we've all seen the benefits of increased digitalization, the development of sort of single or social registries in different forms, which have potentially enormous efficiency savings, both for the organizers, the administrators of those processes, and for the beneficiaries, who, you know, hopefully only have to register once, provide their information once with much less documentation. The benefits can be huge and speed up the response of the system to their emerging needs. But what goes along with that, if you have a single social registry, if you fail to get on board once, or if you're rejected for sort of proper or improper reasons by local officials once, then you may find yourself excluded from everything. So there's a real sort of jeopardy issue, I think, for the vulnerable. And some of that exclusion may be through error. Some of it may be sort of more malign than that or reflects of local dimensions of social exclusion or prejudice. So the ability to appeal beyond that, the existence of good appeal and grievance redress mechanisms becomes an even more important part of the system. And then the other dimension that in answer to your second part of the question is, I think, around inclusion of whole groups. I mean, are women, are single mothers, are particular social groups better treated by more localized systems or worse treated? To what extent is there a role for a central system to enforce or to assure standards of inclusivity? And I don't think there's an easy answer to this. And local decision making may bring with it sort of decisions that are not sort of welcome from another perspective. But again, I think if central government aspires to certain levels of inclusivity, universality in provision, equity across the country and between groups, then the ability to, in a sense, to oversee that and to try and overlay that on the local autonomy, or at least encourage or advocate, if nothing more, becomes pretty important. Sorry, I hope that's not too long an answer. But
no, that's great. Thank you. And it's really, you're getting to this careful balancing, isn't it, of sort of entitlements and the role that social protection is meant to be playing in equity across the country. But then how you balance that with these issues of accountability, exactly, and the roles at local level, and you know, what does monitoring mean? It's all carefully tied up in this, you know, what are the roles and responsibilities, and how do you make sure that those entitlements, you get the benefit of this, you know, entitlements and rights, a rights-based approach balanced with then delivery on the ground. So yeah, there's no easy answers, and especially in practice and for individual groups. So Tiago, what's been your experience with this in the Brazil context, and how that's balanced across, you know, subnational levels?
Well, as I said, we have very good experiences, and we have some bad experiences as well. And to control that in the registering process, it's important to have, together with the systems, it's important to have some complaint mechanism, grievancy, ombudsman rules, public lawyers in some ways. Social control, it's very important as well, and the central monitoring of the process. So in the Brazilian case, using the national statistics, all the municipalities, they have goals for registering, and they are paid when they achieve this goal. So there is a kind of also a monitoring, a management tool that allows the federal government to pay more for those municipalities that fulfill or that achieve the goals using the national statistics. So with this, with all these tools, we can say that we have a very good registry, but we still have some challenges that we try to use the active search ideas to bring all those families who are more vulnerable and need to be inside the national registry.
Thanks. Yeah, and Vilma, how is this? You know, what were your experiences in the Philippines with this? And I guess I'll add another curve into it, bringing in one of the other questions that is also a good segue into the localization piece of it. because localization can mean a couple different things. I think to some people on the humanitarian side, it tends to mean one thing, but then also it can be about the role for, say, civil society and, you know, how that's managed, especially in the context of a crisis. So I might add that in, but in general, you know, how in the Philippines was your experience of dealing with these issues around inclusion and accountability?
Okay. It's varied actually. There are different, you know, reaction, different situation in every municipality or every local government unit doing the targeting. First, the inclusion and exclusion error. There's a grievance redress that had been set up for that, and that had been agreed by the national government and the local government that anybody who are not within the list, they can file complaints and that can be looked into. However, in some LGUs, there are cases that these complaints are just, you know, put in the box, not acted upon, and there's really some sort of real situation when lots of people are not included in the social benefits or in social assistance or whatever social protection, adaptive social protection implemented in the localities. So in terms of your second question on the localization, again, it varies in terms of implementation because not all of the local government units are compliant with national policies. They have their own set of guidelines, particularly those programs included in the devolution. There's a Republic Act or a national law which devolve specific programs, one of which is disaster relief operations. So in terms of you know, coordination and our work with the humanitarian organization, most often coordination between humanitarian organizations and the government is done through the National Disaster Risk Reduction Management Council. And there are specific agencies mandated to lead particular disaster phases. Like, for example, who leads the response, who lead the preparedness, the prevention, mitigation. So the humanitarian organizations with particular focus on specifics, then they have to deal with the counterpart or the focal agency for that particular concern.
Thanks. Yeah, it speaks to just the level of complexity with all of the coordination in the decentralized context of these roles and responsibilities, as well as lots of different actors. Yeah, thanks, Bill. So maybe I want to make sure we can get as many questions as possible across the range. I know we've got a lot of them in there, but one that jumped out that was a bit different, and this may be more one for Andrew, because it's very different context to Brazil or the Philippines. But you know, what about in conflict settings, for example, or where you've got you know, protracted conflict and IDPs or refugees, well, maybe more IDPs, you know, what are have you seen globally, and what is the implications of decentralization in those contexts? We've got populations sort of forcefully displaced, etc.
I don't have a huge amount of personal experience to offer in this area, but one aspect that I have seen at first hand is in the Lebanon, and the efforts of the Lebanese government to absorb a very large number of Syrian displaced persons, and so not IDPs strictly speaking, but and the issue there that I've seen was not even at a so much at a municipal decentralization level, but even within a national education system, the difficulty of different regions and local areas to simply to build schools, to provide services for a large number of children, where provision even for the pre-existing population was not huge. So, I think we can extrapolate that to other forms of social policy, and yeah, I think it would apply to sort of decentralized forms of social protection as well. That the impact doesn't land universally uniformly across the country. Some districts, some areas end up with a much larger share of the problem to deal with, and then how you equalize resources and provide central assistance to support those in even those sort of deconcentrated central government structures in those areas becomes a very critical issue, and one that the government was struggling with even for the current crises.
Yeah, it's definitely in those settings. It's extra challenging, and it depends a lot on the extent to which government is functioning, doesn't it? As well as the roles and responsibilities, and then linking in the sort of interrelationship between humanitarian provision, where can government systems provide it or not. This is something we've been definitely dealing with in space throughout the year. So maybe get a slightly broader question then, and so more in context where there is a functioning state that's acting in the interests of its citizens. But even there's the tensions and competition between central and local government, and are those tensions inevitable? I think it sounds really interesting the way that's been resolved, both in Brazil and in Philippines in different ways, just based on the functions as they were devolved. And what does this mean in the adaptive context, and where is it that say if disaster response is a local responsibility, like it seemed to be in the Philippines, is then what is the role then of the central government? And I guess also if development partners come in here and then just try dealing at the central level, but responsibilities are at a lower one, what challenges does that create? So yeah, maybe just Vilma, on would you have a second to go into some of those relationships and how that worked between central and local on the disaster response?
Okay. Now, disaster response by law, well, first, the national government has the NDRRMC. It's it manages the disaster response, disaster rehabilitation, preparedness, mitigation, and the other aspects. But the local government code, the law that provides for devolution, included the disaster response operations as a devolved program to the provincial government level. Okay, so the provincial government is supposed to provide whatever humanitarian requirements the affected population needed. But in the Philippine situation, it's not always that case. The national government has always played a majority role in terms of financing because of the limit in terms of the fiscal capacity or fiduciary capacities of the different levels of LGUs. So the law requires the national government to provide augmentation support to the level of government where programs are being devolved. However, in more often than not, the national government is the main provider of support. The local government units providing based capacities. So it differs from LGU to LGU.
Oh, interesting. Yeah. And so, Tiago, in terms of Brazil and your experience there, I'm wondering also, say in the context of the COVID financing, that initial financing that was available for the emergency program, um, are there any tensions between the central and the local level in terms of prioritization of those resources, or were they already determined at the central level that this amount of money would go specifically for the Auxílio Emergencial, or was there an amount that was allowed to local levels, and then there was some discretion about how to allocate that across varying needs? So how does that decision-making process about resources and prioritization happen in the context of these programs?
Well, in the case of Auxílio Emergencial, what we had was using the national registry, and those who were already in Bolsa Família, those are the first groups who were allowed to receive the new benefit from Auxílio Emergencial, and the federal government opened a new way of registration using phone apps that to register those who were out of the traditional registering process. So it was interesting because it's a very technological way. You can say that in some sense it can be the vulnerable groups would be out because they do not have an iPhone or a specific telephone that the apps can be used. But using the traditional system from Bolsa Família and the single registry, the most vulnerable were also reached. And for those that some people call the missing middle, those who were out of the traditional social assistance systems, those ones were the ones that could register in this new app. And it worked quite well with the federal government using other federal administrative databases to check and cross-check the information that was self-declared by those in the apps. And this made possible this huge program that was Auxílio Emergencial. But as I said, it used the tools and the experience of Bolsa Família and the single registry, but at that moment it was a very centralized response. Some states and municipalities they have the kind of complementary actions, other benefits, or they supported some of those who could not apply in the registering process, but it was a kind of support that they give for the federal government that was launched in response of COVID. In other areas, the competences were there are very huge discussions. In the health side, we have different views from the pandemics, from the federal government and for states and municipalities. And we have a lot of conflict about how to respond to COVID in the health side. But in the social assistance side, that was a good way to respond to this huge crisis that we had now.
Yes, really interesting. Even showing that within one country, there's not even one solution. In that, actually, it was a combination of this centralized addition to the decentralized one that was there. So really good food for thought. And kind of, we don't have a time to get to one of the last questions that came up that was specifically about what do you do about countries that are already decentralized, and how do you sort of think about the best way forward for those things? And there's no simple answers for that. You could have I'd spend days, let alone a presentation on this. But I wonder, maybe just as everyone, each of the panelists will have a couple minutes now, 1 or 2 minutes, just for the sort of summing up last thoughts on this. And and maybe beginning, we'll go in order again. So Andrew.
Right, thank you. I'm never sure it was an advantage to go first or not. And I do have a couple of thoughts around sort of learnings in this area, one of which I think addresses some of the questions which we haven't got to in detail from the Q&A around what can humanitarian actors, development partners, others do to support the systems. And I think one of the key learnings from recent events, and I'm thinking of sort of Ebola and other health crises in West Africa before we get to the sort of the COVID pandemic, is that in health and in social protection systems, the emergency response works best when it's building on strong pre-existing systems and delivery methods. And the more you have to do to build those mechanisms on the hoof in the emergency, then the weaker your position is. And I think part of that then, in terms of what can be done, is in some systems particularly, maybe it's going even further locally, beyond the local government structure, the municipality structure. In many countries, not all, there are local voluntary structures and systems which support aspects of that system in terms of outreach, communication, enrollment or identification, registration of individuals or households. And maybe that's an area where, in terms of building stronger systems, people could look to be providing more support, often very under-resourced local structures that provide an important underpinning to what's being done by municipalities. And then at the same time, in an emergency situation, how do we avoid decentralized structures competing for scarce resources? Where I think in some places, in particular, vaccines and personal protective equipment availability became very critical during the COVID emergency. How can we centrally best coordinate the availability of those resources so there's not simply a bidding market between decentralized units? So those are my sort of two slightly sort of disparate thoughts in that area, but I hope that's makes some addition to the conversation.
Yeah, thanks, Andrew. Tiago.
Well, just 2 points. First, I want to answer one of the questions about the NGOs, the role of NGOs and social organizations. With our experience in Brazil, I think they have good possibilities to work together with government. Also, I always believe it's a complementary action. So we have very good experience in the active search with the NGOs. We have also monitoring and evaluation, a good experience with NGOs, a kind of experimentalism with NGOs running pilots of new programs and new ideas that the government cannot do. It also works very well. And the social control side, they have developed very good interventions on these areas. To finalize, I just want to say again what I said during my presentation, that it's very important to be aware that decentralization, localization did not become a tool to erase or to erase inequalities. So it's very important to think about ways, tools to make a kind of homogeneous floor steps and benefits that all are national, and also with new stuffs and new ideas, new programs and projects coming from the locals. So the combination of that, it's the way that I believe things work best. Thank you.
Thanks, really important points. Vilma.
Okay, yeah, 3 major insights. First is that of, maximizing the existing pre-existing structures that are proven to be effective and proven to be efficient in terms of delivering social protection or adaptive social protection at the local government unit. Now, moving ahead from that, the existing structure is that of ensuring a systematic interoperable database or systems that would facilitate coordination, agreement, and partnership between the national government and the local government. The second is that of, this is quite important in terms of localized or decentralized implementation. How can we help the local government units set up a predictable source of budget to support implementation of social protection in their locality? So sometimes it's easier said than done, but local government units, while they have their resources, they also have lots of limitations and imbalance in terms of the population requirements, the needs of the people, with that of how much they have at hand. Okay. Now the third one is that of the importance of having a simple, easy to understand communication strategies between the national government and local government. And as I said, the importance of simple communication, I would like to connect this to having the collaboration, the partnership, the respective roles of national government and the local government units in the design of the social protection. While it cannot be, indicated as detailed, but what would be the governing or the guiding principles in terms of partnership between national government and the local government units? Thank you.
Okay, thanks, Vilma. And so I know we're unfortunately out of time, as we could carry on forever, but thanks so much to the panelists for managing to do so much information in such a short presentation. Thanks to GIZ, the World Bank, and SPACE, who jointly co-organized this. And thank you very much to all the attendees for joining and for your fantastic questions. I know we're a minute over, but just wanted to add that there will be, Andrew's paper will be upcoming on SPACE, so keep an eye out for that on socialprotection.org, and that keep an eye out as well for the next webinar in the series on Tuesday, the 23rd of September, that will focus on building block 2 on the program side on digital government person G2P payment mechanisms. So we'll end it there, but thanks so much to everyone, and have a good rest of your day wherever you are.
Thank you very much, everybody.